You don't need to memorize every EKG rhythm to pass the Nclex. You just need to recognize which ones are dangerous and know what action the nurse must take next. EKG interpretation isn't about memorization, it's about prioritization and safety. Today, we're breaking down how to look at rhythms using rate, rhythm, PR interval, QRS complex, and most importantly, what your nursing action should be. First, the big picture. Whenever you see an EKG strip, think, what is the heart rate? Is the rhythm regular or irregular? Is the PR interval normal? Is the QRS wide or narrow? More importantly, is the patient stable or unstable? This clinical approach to ECG interpretation is exactly what nclexprepcourse.org teaches, breaking rhythms into patterns and priorities, not memorized names. Rate. Count the beats. Too fast? Tachycardia. Too slow? Bradycardia. If the rate is too slow and the patient is symptomatic, low blood pressure or dizziness, it's time to act. Rhythm. Is the spacing between QRS complexes consistent? Regular, predictable intervals. Irregular could be atrial fibrillation or other issues. Irregular rhythms often require increased assessment and possibly intervention depending on symptoms. PR interval. This tells you how long the impulse takes to travel from the atria to the ventricles. Normal PR good conduction. Prolonged or inconsistent possible block. But here's the Nclex key. Even with PR changes, you prioritize patient stability over interval numbers. QRS complex. Narrow QRS means the ventricles are depolarizing correctly. Wide QRS suggests a ventricular problem. Wide QRS rhythms are higher risk and typically require urgent action or notification of the provider. So when is it dangerous? Not every strange rhythm on paper is a nursing emergency. What is concerning and what Nclex tests is who is unstable and needs immediate intervention. Ask yourself, is the patient hypotensive? Is oxygen saturation dropping? Is the patient confused or short of breath? If yes, intervene. This clinical priority thinking, not memorizing every complex rhythm name, is the foundation of the ECG modules at nclexprepcourse.org. Examples of immediate priorities. Ventricular tachycardia with pulse, prepare for cardioversion. Ventricular fibrillation, start CPR and defibrillate. Asystole CPR immediately. Bradycardia with symptoms atropine per protocol. Notice something? These actions aren't about remembering names, they're about recognizing dangerous patterns and acting fast. Final priority reminder. Always correlate the rhythm with the patient's clinical condition. EKG interpretation on Nclex isn't a quiz, it's a simulation of real nursing logic. Is the patient stable? If not, act. For rhythm interpretation frameworks and real Nclex logic, not just memorization, check out nclexprepcourse.org. Their ECG breakdowns help you think step by step so you won't freeze under pressure. EKG doesn't have to be scary, you just need to know what threatens perfusion and what action comes next.